Let's talk a little bit about lumps and bumps on your baby. We'll start with the head. Sometimes you're going to see something on the top of the head called a caput. It is a swelling that's sort of boggy and soft on the top of the head, and it means they hung out in the birth canal a little too long. Don't worry, it's going to go away. Some babies are so hard to get out that the OB doctor will actually use a suction device to pull them out, and this will cause a little mushy lump on the left or on the right side of the back of the head. This will also go away as well. It's called a cephalohematoma. The little soft spot in the middle of the baby's head is something that you don't need to mess with or push on. If it's bulging out like a balloon, that might be a problem. But if you see it pulsating a little bit, nothing to fear. This is very common on a baby. The baby that you have may have on their face as well a little skin tag, maybe sticking out in front of the ears. These things are common, and when you see them, we can often tie them off and make them go away unless they're really thick. Then we have to leave them alone. Moving down, you're going to notice on babies' fingers, some babies have a tiny little extra finger coming off of their pinky finger. This is a genetic problem. We see it with moms and dads, and it's something that you don't do anything about.
Little bit of Valivapo will heal that sucker right up.
We interrupt this program to bring you a special word from our sponsor.
Achoo! Did Billy sneeze?
Oh, I think he did. What do we do? I'm gonna tell you folks exactly what to do. You need Vapo. In fact, new Valo Vapo. And get out of my house. Who let these people in?
Possible side effects include wheezing, more wheezing, even more wheezing, a terrible asthma attack, worsening asthma, worse cough, smelling like grandma, coughing like grandpa, not getting one bit better, even getting a lot worse, and not to mention death. We now return you to your program already in progress. Don't worry, you didn't miss anything.
One more thing on the head. A lot of parents call me about a pea-sized lump on the back of the baby's head that doesn't hurt. If you have this on your baby, it's always a tiny lymph node and it doesn't mean a thing. Please don't wake the doctor up in the middle of the night about this tiny pea-sized bump. You can talk to him when next time you come to the clinic. Some babies are so huge they can't get out unless their collarbone breaks. When this happens, as it heals, you'll sometimes feel a small lump right in front of the break on the collarbone. Nothing to do about this. It goes away on its own. As long as the baby's arms are moving normally, we don't have to worry about that. Did you know that sometimes little boys or girls, the breasts will swell up and they'll make milk?
What? Oh.
If you see this, it's natural, it's going to go away, but please don't squeeze them. And yes, I know, Dad is gonna say, why don't they just feed themselves, ha ha. But it's something that we see all the time. But pushing on it could cause a little trauma, and so just leave it alone, and that goes away by itself. Probably a good idea not to mention to them when they get older that this ever happened. We can just drop it, now you know what it is.
Huh?
Moving down to the belly button, you may see it bulge out a little bit. Sometimes it can get as big as a tennis ball. If it gets that big, a doctor needs to weigh in on the subject. But as long as it's smaller than a golf ball, there's not a whole lot you do about it as long as when you push on it, it'll go all the way back inside. This is something that's called an umbilical hernia. And this is the reason why people that you might know have outie belly buttons. In most cases, it just goes away on its own as the stomach muscles strengthen. But if you notice that it gets bigger and bigger and it gets to a tennis ball kind of size, you need your doctor to talk to you about what to do next. And you don't need to go to the ER for something like this. There is something that's very dangerous that some people do with umbilical hernias. They take a coin and they tape it over the belly button, or they'll wrap something around the body that pushes it in, called a faja.
Oh, I just use a chip clip.
This is dangerous because it can kink the intestines that are in that hernia off, and it can cause them to lose blood flow, what's called an incarcerated hernia. That can actually kill a baby. It is very serious, and it should never, ever be done.
Well, I didn't know that. Did you know that? Should I put a mirror in front of your mouth?
If the hernia gets as big as an orange, you'll probably need to get surgery to fix this for baby. But as long as it's smaller than a golf ball, there's nothing you really need to do about it.
I know a guy who had a tennis ball removed. It was the size of a tumor.
One more thing. You know, some dads notice that their son's testicles are very large, and they feel proud that they will have a virile young man one day. Reality is that that doesn't mean this. A lot of time that's a hernia into the testicle area, or it's something called a hydrocele. Let your doctor know about it. You can wait to address this problem in the clinic though. You don't need to go to the emergency room for something like that.
In a world where disclaimers are boring one man.
Excuse me, Mr. Movie Trailer Voice Guy. Please just read the copy in front of you.
Oh, sorry. This video is intended to give you informative, educational information. It is not intended for you to self-treat or diagnose yourself or your family. Because we want you to make good medical decisions when it comes to you and your family's health. Please first talk to your doctor before trying or attempting any of the information that you have seen or heard in this video. Thank you.